Hi, my name is Tammy, and today I will be demonstrating for you the various different classifications and their associated variations of Swedish massage. To start with, we're going to demonstrate Effleurage. Effleurage is taken from a French word meaning to glide. So anytime you are gliding over the surface of the skin, we're going to be performing Effleurage. One of our first variations is what we call lean and drag, or can also be called transitional. This is the stroke that applies the lubricant like I am doing now. It assesses and warms up the body part, and it gets that blood flowing. Effleurage. Transitional lean and drag effleurage. It can be done two-handed. It can be done one-handed. Although on the legs it's not really effective because we have a larger area to cover, so primarily on the arms. We also have alternate, kind of like follow the leader. And we're always with our transitional. Our drag stroke is our nerve stroke. We can do with knuckles, a two-handed knuckle. We can use our forearms, and we're still nerve stroking back down. We have a superficial, circular, and again, you can see that I am gliding over the surface of the skin. Now, for our deeper strokes, we have ironing and we have deep circular effleurage. In order to perform those, we're going to divide this leg in half, still moving toward that heart, proximal to distal. So let's do that. Remember, our deeper strokes with effleurage move a bit slower. That way the tissues have a chance to respond appropriately. It can be a two-handed ironing. It can be a one-handed ironing. Or we can use our forearms. Same thing with the lower leg. Effleurage ironing. Palmar, knuckles, forearm. One-handed or two-handed. Followed by our transitional lean and glide effleurage. Usually to say goodbye to a body part, we use our most superficial, and this is the drag of the transitional effleurage. We're using that first pad of our digits. Our second stroke will be called Petrissage, also taken from a French word, and it means to knead, to lift. There are various different variations. Our first one that we're going to cover is our alternate. And again, we'll start proximal to distal. And this one is, we're kind of going over the same area twice. One hand and the other. And you'll notice that my stance has changed. Now we're into a horse stance. And we're going to cover the entire thigh. Lifting and kneading, lifting and kneading. We can also do this on the lower leg, a bit more digital, because it's a smaller area. lifting and kneading. Still heading toward the heart centripetally. Then we have another one, lifting and kneading. This one is called ocean waves. And what we do is we will use our horse stance, but it becomes more rhythmical in nature. You'll notice that as I grasp the tissue, I lower my body, and as I lift, my body rises. Ocean waves. And if you'll notice what my hand's doing, the one on the lateral side is always up, the one on the medial side is always down. Ocean waves. And again, I can do it here on the lower portion using more of a digital lift. Then we have another stroke, just anchoring that drape down a little bit, and it is called skin rolling. And do you see how it does require a lift of tissue? And I am walking, lifting and walking, lifting. So it sustains that tissue as I move it over. Same thing here on the lower leg. Makes me think of the itsy bitsy spider. And then we have another stroke called praying hands. And again, we're lifting and kneading rhythmically. And this one will go in the direction. So if I'm moving vertically, then I will be in an archer stance. Lifting and kneading those tissues, bringing much more hyperemia to those areas, increased blood flow. And then we can always flush that area out with our transitional effleurage. Our last Petrissage stroke will be our lift and broaden. It's called fulling, and it combines two of them. We lift the tissues up and we broaden them out. We can take smaller bites by starting with the lateral portion, lifting, kneading. And lifting and kneading those tissues. And once again. Gathering them up and broadening them out. Gathering them up and broadening them out. The next stroke is friction. Friction is taken from a French word that means to rub. And actually, oftentimes what we're doing is superficial and deep, superficial to deep. And this one is often called the treatment stroke because it's a bit smaller areas except for our superficial warming. So let's start with that one. So again, we're going to be in our archer stance depending on which direction we're going, and superficial warming. And you can see the movement of superficial layers over some of the deeper layers, not too deep with this one. A lot of nice blood flow on the surface and warming up the structures. Okay, so let's do some rolling and ringing. This one is we're going to compress from the side and we're going to move once again. Starting at the bottom of the limb, so we're making sure we're heading centripetally. We're rolling those tissues over each other, superficial to deep. Superficial to deep, rolling. Our next one is ringing. This one I'm going to stand in a horse stance, and what we're going to do is, once again, I'm compressing those tissues, but I'm moving them over the deeper layers and creating a movement where we're really getting into a lot of that fascia, breaking it up, and we're moving those tissues over each other to rub. And once again, to rub. This stroke really feels good. Okay, now these next 3 strokes, transverse, which is also called cross fiber friction, I'm going to be moving the structures crossing the muscle fibers, and we're going to do superficial to deep, transverse. So you really need to know your muscles and the direction of those fibers. Now you'll notice that I am not gliding over the tissue. What I'm doing is moving the tissue over each other, under the underlying tissue, superficial to deep, superficial layers to deeper layers. And you can see why it would be done in a smaller area, maybe an area that has some adhesions, some scar tissue formation, those taut bands, that hypertonicity within the muscles. I can also do, and I can go up the entire leg. Oftentimes I find it's kind of nice as I go across the hamstring fibers, and it's a bit more broad-based, but I'm still just working cross, and I'm taking what I call little bites. I'm not gliding, but I'm certainly addressing any taut bands or hypertonicity within those muscles, transverse or cross fiber. So again, going with the same rule of thumb, then I'm going to do my circular. This way, this muscle is being treated, or this tissue is being treated from all different directions. And once again, it can be done two-handed, one-handed. I can even use the heel of my hand, and I cover a little more ground that way. I can use my knuckles. Again, circular, circular, circular. And then we have parallel, or chucking, which is going to go along with the muscle fibers. Here I'm in between the heads of the gastrocnemius. And you can see, once again, it's a smaller area. And for this one, I am in my archer stance. IT band, I can use it broad-based. Use some knuckles on there. And I can work my way doing some friction, rubbing the superficial layers over the deeper layers. And that completes our friction variation. The next stroke will be Tapotement. And this one is done not all over the body. It can be used for toning. It can be used once all your strokes are done as a way to say goodbye to the body. But there are some things to think about with this stroke. Lots of variations from superficial to deep, but we need to be careful of our endangerment sites. So one would be the popliteal area. Another one would be lower back. We want to think about the bends of our arms or around that elbow area. Pretty much between the tibia and the fibula, the shin bone, there's really not any reason to go down that low. Quadriceps, great area to perform this stroke, but avoid the bony prominences. So let's look at some of these variations on this posterior leg. So first we have our hacking. Make sure you keep your wrists loose so that you're not hurting anyone. This is also taken from a French word meaning percussion or a light blow. You'll notice that I can do it alternatingly. And then I was coming into my simultaneously. We have pincement that almost looks like plucking. Great for hyperemia in that skin. We have our beating. Again, don't tighten those fists too much. And simultaneous. Alternating, beating. Some people call this pounding. And simultaneous. We do have tapping. It's very light with our fingertips. This can be done on the face, a little bit on the abdomen, alternating and simultaneous. Some people alternate their fingers and call it raindrops. Then we have our cupping. Great to do on the chest, the back, the sides of the body, and that upper torso. Great for respiratory. People who have had some respiratory issues. And again, you're seeing me do this simultaneous or alternating. We do have another one called diffused. This one is usually done on the abdomen, but I'll demonstrate on the lower back. This can also be done on the lower back. So what I'm doing is my hand provides that diffusing. So it's not a direct amount of pressure. It makes it a little bit lighter in nature, but still percussion. We have one more that is called slapping or clapping, but we need to be careful about this. If I do this form of variation, then I usually do it through a drape. And because your hands are kind of like slapping or clapping and can be stinging in nature. This is our alternate. And this is our simultaneous. So that finishes our tapotement. Now we're going to move into compression. Compression is also taken from a French word meaning to press or even to squeeze, because you'll see that I will do it squeezing. This is compression, a two-handed compression. You can do a one-handed compression. You can do it alternatingly. And this time I'm using my fist and I'm just mashing. I'm pressing. You can also do this sustained, two-handed. And I'm using right now my archer stance and just kind of leaning in for that depth of pressure. Or I can use one-handed as well. Compression. This can be done just about everywhere on the body. It's something that really feels good. Our last stroke is vibration. This means to shake. And there are fine vibrations and coarse vibrations. So for my fine vibration would be my trembling. And you can kind of see that ripple effect. You can use this to gentle in between some of your deeper work. You can use it to loosen up and relax your client. And what you're going to do is kind of tense up the muscles of your forearm. And you can use the tips of your fingers or the first pad of your finger, or you can use your entire hand. Then we have some of our coarse vibrations. One is going to be a jostle, where I'm kind of shaking those muscles around the bone. Jostling. Or what I could do is I could take one of the heads of the gastrocnemius and jostle it or shake it. And I could do that here as well, shaking. And again, these can be done most anywhere on the body, but oftentimes the shaking is done on the limbs and the jostling is done on the limbs. But again, that jostling, think about in the upper trapezius muscle. That would feel great. So, vibration. Our last form, I'm going to go ahead and cover her up. It's a very soothing stroke. You can start with this as a coarse vibration, or you can end with it. And this one is kind of like a swing. I can do it on the front of the body or the back of the body. And do you see how I allow the body to return back to me? I'm not controlling the movement. It kind of loosens up and becomes very relaxing to your client, rocking. Okay, this ends our session for the day. Thanks for tuning in and have a wonderful day.